Hello, welcome. Thank you for having us here. I'm Sarah Ray. I work for the Pemberton Healthcare Foundation. I'm their executive director, which is a newly appointed position. Very excited about it and everything that we're doing. So, yeah, I guess brief history of me. I was born and raised in Pemberton, moved away when I was 18 because it was very small here. And then was lucky enough, it pulls you back, so came back last May. And lucky enough to get this position with the Pemberton Healthcare Foundation. So my part of the presentation is largely to do with my research in what kind of the medical history of Pemberton was. It's very brief. I had a lot of cool opportunities when doing research here to chat with Dr. Moody, who is alive in Saanich. It was very fun. And then I talked with Kathy McLeod and Janice Snowy and kind of got their experiences of what it was like. So a lot of first-hand tales from them. So a lot of it, in looking for all of this, I kind of learned quickly that Pemberton was very much a logging and farming community. And with that, they kind of realized they needed healthcare. And so it was a lot of just kind of hodgepodging things together and working really hard to make it work. So I have a little bit here that I put together. I'll read through it. I'm going to very much read this. I've not memorized it. And I'm sure a lot of you will maybe fact check me or know more about first-hand experiences, but this is what I got when looking at all of this. So a large part of my research showed that everything kind of initiated and was greatly in part of Bob Priest moving to Pemberton. So he relocated his family to Pemberton in 1964 and opened up the first pharmacy, which was kind of, from what I can understand, the big moving point in healthcare. He was a full-time pharmacist and supported greatly through Dr. Kindry, who would come up once a week from Squamish on a Thursday by train, and he would fit in as many people as he could, which was not large. The town population, I think at the time, was 217, so you kind of hope that they were not all sick at the same time. But he would help any patients in emergencies. Otherwise, people would have to take the train from Pemberton to Squamish or Lillooet, and it was kind of like whichever train was going in whichever direction first. So you hopped on. And then Dr. Moody, so he came to the area initially on a search and rescue. It was a very hot day, probably like today, and he came by helicopter, which they then learned helicopters can't lift in heat that's this significant. So he's a bit trapped in this tiny little town. He lived in Richmond, and I think the mayor of the town took the opportunity of the heat and him being trapped here to try and convince him to become a full-time physician in Pemberton. So he left and really mulled it over. He had a family of 4 and his wife in an established practice in Richmond. So there was a lot to consider to see how lucrative it would be. He did eventually come back up by car. He remembers there was Mary, his 4 kids, a dog, and a cat. They drove all the way up from Richmond, and he met up with Bob Priest, who helped answer any questions and also just like took on the dog, cat, and children, so him and Mary could drive around the community to figure out how lucrative it would be and what kind of the town needs were. He then later came up a second time and they did a house count to see if this was a good idea. And then in 1969 he finally decided that he would come up every weekend after working a full 5-day scheduled shift in Richmond. So he'd work 7 days a week, and he was the weekend physician for the residents of Pemberton. This went on for 2 years, which was a pretty significant time and just like general dedication to the medical system of Pemberton. So after they made a permanent move in 1971, which Mary was shocked by because she was very much a city girl. She was shocked by the transition of moving to this very rural community. The first clinic was built in 1967, and this was largely in part done by the work of the Women's Institute. It was in the old library building. It was poorly insulated, the pipes often froze, and Mary also recalls having to put the radio on, like full blast for privacy, because it was so poorly insulated. There was no x-rays or labs in Pemberton, so everything had to be sent to Squamish for review. Mary bragged about her husband, and she said that his diagnostics and kind of just like the jack of all trades and his ability as a doctor was very helpful in the success of his relationship with the Squamish X-ray and lab, because he was pretty good at figuring out what was wrong with somebody, and when he sent an x-ray or when he sent something, they're like, you have to review this. It's coming from Dr. Moody. He knows what he's talking about, so that greatly helped him a lot. Pemberton was also such a small town, so you knew where everybody lived. And Mary often remembers putting the kids to bed and coming up and finding people in her kitchen. They had let themselves in. They were waiting for diagnostics or help from Dr. Moody. She had a lot of great stories. She's like, maybe just don't say that one. So they obviously identified that there was a larger need for a more efficient clinic. And after many years, and like tireless work from Art and Bob, they finally opened one. It's the medical building that exists today. So it was definitely tireless work. For the last 18 months of his time in Pemberton, Dr. Moody worked without a single day off. He was the primary physician for his 23-year career here. Mary said that there was a lot of concern, obviously, because you can't treat your family. She was always worried that something would happen to her kids. She even remembers Dr. Moody having to stitch his own lip up because he was the only one that could do it. He says it's the worst stitch job he's ever done in his life, which is fair. So despite all of the hard work and the trying times they had, both of them, when I spoke with them, had nothing but fond things to say of their time here, and they really enjoyed it. Pemberton and Dr. Moody were also very instrumental in bringing something called the Nurse First Call program in, which was not a BC-wide kind of practice, but it definitely helped for keeping him here. So what that was that it allowed the nurses to take first call, which gave Dr. Moody more of a work-life balance. So they would receive first calls after hours. They could deal with 30% of the calls. These are rough numbers from Kathy, but she said 30% of the stuff could be dealt with solely by the nurses. 20% would maybe require them calling a doctor to get a second opinion, and then the remaining call would actually require a doctor come in. But it was super helpful in keeping a better work-life balance, and also just giving the nurses a larger responsibility. They had been doing it for significantly longer time than the actual programming and recognition from the province, but their work in doing this allowed for funding to happen for a lot of different rural communities in Pemberton, which is super cool, but very, very necessary. In all of my discussions, I was fortunate enough to note that Pemberton has been ahead of its time in team-based care. All the doctors, all the nurses, everyone I talked to just really recognizes how much everybody works together, from your pharmacists. There was a lot of mention of Milt Fernandez and his work with the ambulance and everybody coming together for how community-based the approach in healthcare is here. And I mean, my personal experience as well, living in Vancouver for as long as I was, shocked with how long it took for doctors to see me for something. Whereas in Pemberton, I feel like we are very lucky and fortunate for what we have and how tireless everybody here works. So With that, the Pemberton Healthcare Foundation and medical team still try to uphold this standard, and we're working towards great future initiatives to help provide the best care possible for people in Pemberton and surrounding area. With that, I'm going to hand it over to Rick, who's going to talk about some of the new initiatives that are in the master plan.
So, hello everyone. For those of you who don't know me, my name is Rick King, and I came to the Valley in 1970 when I was 9 years old. And I think, not 100% sure, but I think that I'm responsible for most of Dr. Moody's income. It's 9 till in the next one. If not, at least I'm setting one of a few vacations. A bit about my history. I spent 33 years with the BC Ambulance Service here. And between my childhood and the 33 years on the ambulance service, I saw a lot of changes in healthcare and how it was delivered and our needs, how they changed, etc. There's been plenty of changes in the ambulance or in the medical department in this valley, and we're destined for some big ones coming up. The Pemberton and District Healthcare Foundation is primarily a portal to receive money for Vancouver Coastal Health. Vancouver Coastal Health themselves cannot receive donations, so we do it for them, and then we give them money as they request it, or if there's certain projects that they have that maybe run over budget, or we feel we want to do a little bit better to make our patients more comfortable, and also to make their experience at our health clinic, they're never nice experiences, but to make them a little nicer. I too am going to have to read from this master plan. So Vancouver Coastal Health recently came up with a Sea to Sky master plan, and they outlined what their vision was for Squamish, Whistler, and Pemberton. One of the main priorities was what they call a home first hub. We want to keep medical treatment closer to home. As many of you know, traveling up and down the Sea to Sky Highway is not always an enjoyable experience, and if you're sick, it's even less enjoyable. Secondly to that, with the BC Ambulance Service, the more we can keep those ambulances in the valley, the better it is for the public here. We do have a fairly high call volume, and if our ambulances are both south of here, that just adds to wait times, which is not conducive to good health care. So their idea is to keep centralized locations for care, providing innovative support mechanisms for expanding at home and on-site services that are scheduled and low risk. This approach will help increase access and decrease travel for rural communities, including First Nations. The draft identifies following priorities for future planning: engagement, investment in Pemberton and the surrounding communities. Right now, Vancouver Coastal Health has launched an initiative to add 6,000 square feet to the Pemberton Clinic. The main part of that is for an oncology outpatient department. So no more, well, I shouldn't say no more. We don't know what level of oncology they'll be able to practice here. It takes a lot of training. We are fortunate to have a lot of doctors and great nurse practitioners. One of our doctors is an oncology specialist, so we're very lucky there. But this clinic will also be useful for IV therapy, drug infusions, hopefully someday blood services, such as dialysis, and so on and so on. Right now, their aim is expanded emergency care capacity to support the delivery of timely care for urgent issues. So that means a larger emergency department. Expanded ambulatory care with a focus on oncology and supporting local minor treatments. Increased support for Indigenous communities, increased inpatient capacity, including observational short stay attached to emergency care, expanded and improved access to prenatal and postnatal care, including structures for Indigenous midwives and doulas to practice in the region, and expanded medical imaging, laboratory, and logistical support. Right now, if anybody's been into the clinic, they'll notice that it's currently under a renovation with our radiology department. Long term, and this is what really excites me, is the 10-year, which could go a little longer, 10-year plan is to actually have a hospital in Pemberton, where we can offer increased home care services, including home care and home support, expanded public health programming, including sexual health, dental care, speech language, pathology, and increased services for First Nations community as appropriate. Expanded support for rural communities, such as more localized teams for mental health, substance abuse, home health, and public health. And in the long term, hospice capacity and services, adult day programs, services and access, capacity to support long-term care and adult programs, and spaces in long-term care that support Indigenous culture, safety, and practices. So, very big changes. It means, in a nutshell, that our community will be able to support our citizens. The less people we have to ship out of the valley, the better. It's better for everybody. So we have something to look forward to. And right now we are raising money for this expansion and to make sure that our oncology clinic has everything that they need. We're doing that through public funds. Golf tournament is coming up. We have a program where we recognize certain businesses in the valley that collect donations for us. If you go to our website, you should find that under Friends of the Foundation. Okay, so we're pretty excited. There's a lot happening. Any questions?
Yeah, Rick, you mentioned that there is an oncology specialist here, one of the doctors is, I guess, at the medical clinic there. Could you tell us who that is, please?
Dr. Leslie, yeah.
Dr. Leslie, yeah.
She was very involved in
Leslie, yeah.
Okay.
Dr. Leslie. She was involved in a lot of healthcare in Haida Gwaii, and she took a lot of additional courses there.
We also have another doctor that is retired but lives in the valley, who started the oncology clinic in Haida Gwaii and has expressed interest in helping us get this launched.
Fantastic. And could you please define for us oncology? What exactly does that cover?
Basically, it's cancer treatment. Yeah. So right now, if you have to have chemotherapy, you have to go to either Squamish or Vancouver. There's 3 levels of oncology care. And it's determined by what sort of drugs you require. Some can be mixed on site. Some can be mixed and couriered to Pemberton, and some cannot. We need, as part of the oncology clinic, we will need to put in a fairly sophisticated pharmacy where these drugs can be mixed. And it'll be up to the BC Cancer Agency what level we're at, 1, 2, or 3. But even at level 1, it's going to stop a lot of people from having to go south. And if we can prove that level 1 works, then we can shoot for going higher. Yeah?
Would that include radiation, or that's one step too far?
At this point, no.
Yeah, thought so.
No, this is just drug therapy. The radiation is a whole different ballgame.
Yeah.
Go ahead. After you.
How is the Health Foundation working with is there a working relationship between the Leetwa and Lower Statly and
At this point,
health services?
we've had conversations,
Good.
but we don't have an established. Obviously, they're included in the Pemberton District Healthcare Foundation wholeheartedly. But in future, hopefully, once these things get off the ground, they'll be more active.
Like they were in the past.
Yeah.
Thank you.
Do they have an ambulance service in the Lilwat Nation or the Mount Currie area?
No. So
That's what I was wondering. Why don't they? Because we live out near Mount Currie, and
Yeah.
probably every other day at least, if not daily, we hear one or more ambulances going by to Mount Currie.
Yeah.
Wondering why they don't have their own ambulance service.
It's based on government funding and call volumes. So right now, Pemberton has 2 full-time 24-hour cars, and then they also have an afternoon car. And I'm not sure, I can't tell you what their call volume is now. But we've gone from a completely part-time crew to having somewhere in the neighborhood of 16 full-time members now.
That's amazing.
Yeah.
And as I understand it, some of this funding is being collected in the name of Pat Kelly.
Yes, so Pat Kelly is, if you don't know who he was a real estate fellow that started with the real estate company. And when he was diagnosed with cancer, he told his wife that he wanted his legacy to be an oncology clinic in Pemberton. And the Pat Kelly family and friends have donated a very large amount of money to go towards that. Donations to the Pemberton District Healthcare Foundation can go a number of different ways. If you give money to them or to us, you can designate where you would like it to go, whether it's just general funds. Right now we're raising money for the oncology clinic, so our focus is on that. But once it's up and established, then we'll have a new target. And Pat Kelly was very instrumental in getting this all going.
What does general funds cover?
So
Doug.
if we've donated over the years that I've been with the health board, which is about 12 years now, we've purchased stuff like radiology equipment, better hospital beds, an ultrasound machine, an otoscope. These all come out of general funds. We even did some renovations in the Emerge so that the nurses could have some resting quarters while they're working a 24-hour shift. So it's widespread.
And
those are all, to us, they may not seem small, but they're small ticket items to an emergency department. They're not overly expensive, but they do cost money. And our aim is that like I said before, anything that's going to make a patient's visit to the clinic more comfortable is what we want to see.
Thank you.
Thank you.
Rick, where are they planning on building the new hospital?
So I'm not sure if it's going to be modular or permanent structure.
Okay.
They are just weighing their options right now. But basically, the footprint will be between the condos at the back of the clinic.
Okay.
Yeah, and I've been told it's 6,000 square feet.
Right. Okay,
So
thanks.
it's fairly substantial. What actually is going to be in that part, I don't know, because there will be some restructuring in the old building.
Yeah.
And then the talk is, in the future, they could build a small hospital on the land that they already have without disturbing the function of the current clinic.
But you said that would probably be a 10-year plan, or we're looking at it right now as a 10-year plan.
Yeah.
So do you think Liz and I will be able in 10 years to take advantage of an expanded care facility for long-term care patients?
Oh, healthcare.
Huh?
How healthy are you these days?
Oh,
We hope you're still around in 10 years.
failing quickly.
Yeah.
Glad to be.
The 6,000 foot one will be up, not the hospital, but the clinic expansion, yeah.
All right. Good stuff. Also, you mentioned about, I think if I heard correctly, you mentioned about a training for indigenous midwives or something to that effect.
That's Vancouver Coastal Health. That's something that they have included in their master plan.
I see.
I couldn't tell you what that involves. But I think what it is probably so that we have better child deliveries in this valley. There's I have to tread lightly here. There's a lot of babies that are born in not the best of circumstances, whether it be at home or in the back of an ambulance. So I think their focus is just better prenatal care and better delivery of delivery services.
Is there a doctor stationed at the new health clinic in Mount Currie or up at the new site and so forth?
I believe the doctors from the Pemberton clinic go up there.
Oh,
Right now we have 10 practicing physicians in Pemberton and 2 nurse practitioners. We're very lucky. Because nobody in this valley should be without a family doctor. And that's rare these days. We need to keep them.
Huge.
Keep them happy.
Well, I hope I've answered your questions.
Thank you.
I hope I've given you something to think about.